My name is Johan Sidén. I'm from Mid-Sweden University, which is located, as the name implies, at the middle of Sweden, in a city called Sundsvall. I'm working in an electronics department with wireless sensor networks. Yes, I will present our wireless approach now for wireless sensors and how it could potentially be targeting healthcare applications and how you can use modern smartphones. Most people today knows about Bluetooth. That was developed like 15 years ago and was established in almost every phone now. Today you have yet another wireless interface in the phones called NFC. This is like a small magnetic field going out from the backside on the most modern phones. And with that, you can actually read our sensor tags, for example, reading temperature, humidity, and then it's up to you where you want to measure this temperature, humidity, maybe hazardous gases or odors. This technology has been available for quite some time now. It's called RFID. It stands for Radio Frequency Identification. And then NFC, this near field communication, is like a computer layer on top of RFID, simplifying things and specially adapted to be put on cell phones. So this old technology, they required RFID readers that costed about 3,000 euros plus taxes. But now when everybody has an RFID reader in a common cell phone, you have it whether you want it or not. Let's take advantage of it. And you will have it in tablet PCs as well. So for example, probably not seen in the camera now, but if I take this prototype tag up, this is not the most beautiful thing you've seen, but you can see that it's small, and you know that electronics can always be smaller. And I touch it with my phone. I just have to confirm it because it's a security issue. I'll see that, okay, it drops to 26.7 degrees here in my pocket, which is pretty much what it is. And then, of course, you can put it wherever you want to measure temperature. Maybe something else that people more working with healthcare environment can help with. I'm not the expert on that, but I'm providing the technology and collaborating. A disadvantage with using exactly this technology with cell phone is that it's called a touch technology. You will have a communication distance of about 5 to 10 centimeters maximum, which could be okay in some applications you're talking about, like concrete and walls. We have done some tags on actually installations in Sweden. We put moisture sensitive tags inside households, and then you can actually measure them because they're just a few centimeters in the wall. Because moisture provides a huge problem in Sweden. The insurance companies pay much more for moisture damages in houses than they do for fires, for example. And we have also used it in the Sundsvall hospital in my hometown to read the status of adult diapers, measuring how wet are they, trying to figure out when you should change them. And this is especially in the night time. And if you can have longer distance, can you have a reader up in the ceiling that just puts a radio question once in a while, checking your diaper status. You don't have to wake the patient up or the elderly person up to check the diaper status. And that is a bit what I'm going to talk about.